This is part 1 of my medication series, starting with antibiotics. We have 6 categories here, so let's run through each one. This is a very summarized key list for all these medications and their most important characteristics. First, we have broad-spectrum antibiotics, which end in -cillin like penicillin or start with ceph like cephalosporin. Being broad-spectrum, think it's okay for a broad amount of people, like pregnant women. Also remember that cephs and cillins contain very similar properties, so an allergy to one will almost always mean an allergy to the other. We want to take these meds with food. If we experience GI upset, shake well, and watch these side effects for each med. Next, we have metronidazole, which stops the growth of certain bacteria and parasites. These are used for conditions like C. diff and STIs. All medications we should avoid alcohol, but Flagyl specifically, we want to wait 3 days after treatment to consume alcohol again. Big key, signs of a new rash or skin peeling can be indicative of Stevens-Johnson syndrome and require immediate treatment. Stay tuned for part 2. Part 2. Highly toxic meds end in myosin. Remember, it's a sin to give as they damage not only the liver but the kidneys and ears too. Because of this, we monitor peak and trough levels before administering and we look for signs of toxicity. These will be specific to the kidneys and ears. There are 2 different kinds of myosins. One causes red man syndrome. Think of a really flushed red man, so administer slowly. This is not deadly, so don't worry. The other kind does not produce red man syndrome, but it's very toxic if given with the first one, so pay attention to medications ordered. While all antibiotics are harmful to the liver, ones ending in thromycin are extremely liver toxic. Watch for elevated LFTs and take a look at those EKGs. Tetracycline, think of a bicycle rider. We need to avoid the sun and do not take if you're pregnant. Avoid calcium and iron because they block absorption. And for both of these meds, we only take with a big glass of water. Last are UTI meds. For sulfa drugs, think SOFA. It's indoors, so we're staying away from the sun outside. We encourage water and folic acid and don't give these during pregnancy. Drugs ending in fluoxetine, think of a flock of birds. We want to avoid the flock of birds outside and take these only with a big glass of water. And of course, finish all prescriptions.